Okay, so it's really my honor to be here to share some experience. So my name is Dr. Jie Bai. I'm a medical director of Fresh Bay Medical Center in British Columbia. Beside participating the family medicine, I'm also a clinical instructor at the University of British Columbia and Simon Fraser University, as well as a clinical preceptor of the University of Victoria NP program. And there is a IMG program in BC. It's a PRABC program. I'm the assessor and the supervisor. So today, I would like to share how the artificial intelligence is transforming our daily clinical practice. So rather than replacing physicians, AI is helping us reduce the administrative work, restore the valuable time, and ultimately spend more time caring with our patients. This presentation is based on the real world experience from our clinic, where we have gradually integrated several AI tools into our workflow. I hope these examples will provide practical ideas that you can take back to your own practice. Okay, let's go to next one. So before we begin, I would like to briefly mention a disclaimer. This presentation is intended for educational purpose only. Does not present medical advice, commercial recommendations, or any company or software. So the AI tools I will introduce today are simply tools that we have personally used in our clinic and find it to be helpful. Every clinic has different workflows, budgets, and needs. So I encourage everyone to evaluate this technology based on your own clinical environment. Okay. So let's first look at the reality of the modern clinic practice. No matter where we practice, we are all facing similar challenges. Documentations and administrative tasks occupy more and more of our days. Many physicians experience burnout because of so much of their time is spent in front of the computer instead of interacting with patients. This is exactly where AI can help a meaningful difference. So where does AI actually fit into our daily clinical practice? Many people think AI is only about like ChatGPT, but in reality, AI can support almost every step of the patient journey. For example, AI scribes can automatically generate clinical documentation from physician-patient conversations. AI scheduling system can optimize appointments, booking, and reduce administrative work. And there is other is the AI powered virtual medical office assistant can answer common questions, help patients to schedule appointments, reduce the workload of the front desk. Finally, workflow automatically connects all the system together, making the clinical run more effectively. Okay. So the key message is that AI is not replacing healthcare providers, professionals. It is removing repetitive tasks so that physicians and staff can focus on what matters most, caring for our patients. So now I want to share some experience in our clinic. So the first one is Cortical. It's what we use on our website for booking. So the patient can click into our website and click the doctor's name, or there is the online booking. Then with that button, that will go to the AI appointment booking. It can automatically send the patient reminders 3 times, so 1 week before, 2 days, and 1 day. It reduces no-shows. And it streamlines the clinical administration and improve patient access to care. They do not need to wait on the phone. So here is the here is our website. A few screenshots from our clinic. So on the left, you can see that cortical platform that patients use. So that's for patient. On the right is our FreshBay online booking portal. Okay. And after patient booking, so now we set up just after I submitted this PowerPoint, actually we started to using a self-checking system, which is also very helpful. After patient check-in, we are going to use the AI room management. So as our clinic grow larger, coordinating patients, since now we have 12 doctors and we have some like counselors, massage therapist, chiropractor, dentist. So since the clinic grew larger, coordinating patient flow become increasing challenging. So this is a digital room status. This board displays the real-time status of every examining room. So doctors and the staff can instantly see whether the room is occupied, ready for the next patient, need to be cleaned, or temporarily unavailable. So everyone has access to the same real-time information, which greatly improved the communication and reduced unnecessary interruptions. Although this system is relatively simple, it has significantly improved our daily flow sheet. I want to show, this is a screen, what the dashboard looks like in the real life. So each room has its own status card. So color immediately indicate whether the room is occupied or ready. I do not have the video here, but if the room is ready, then it's the pink number is flashing. So the MOAs will easily know, and the patient will easily know, okay, so the doctor is ready for the next patient. So that means sometimes the AI doesn't have to be complicated. Small digital improvements like this can have a surprising large impact on daily operations. That's how we use it. Okay, next one is the AI scribe. So I would like to introduce what has probably made the difference in my own clinical practice. I have used this AI scribe for the last 2 years. In our clinic, the one we are using is Amphesia, but I believe there are several pretty good ones as well. So during the consultation, I can focus entirely on the patient instead of looking at my computer. So the AI listens to the conversation with the patient consent, which is automatically generated structured clinical notes, and the patient will click the consent when they were booking online. It also creates patient summaries and education handouts in multiple languages. Another important advantage is that it integrates directly with many electronic medical record system. So we are using OSCAR, so it implants to the OSCAR. It fits naturally into physicians' existing workflow. Okay, I would like to show you the screen. That's a screenshot of the AI scribe. As you can see, this is a demo one. So you can see every patient encounter is automatically organized. So the physician can review the draft and make edits if necessary, and then transfer it directly into the medical records. What I appreciate most is that AI does not replace clinical judgment. It yeah, it may make some typo or mistakes or misunderstanding, but it's easily to be added. So we as the physicians, we review, edit, and approve the final documents. In other words, AI becomes an intelligent assistant, not the decision maker. Okay, as physician, we remain fully responsible for diagnosis, treatment, and patient care. So that's the AI scribe. So here is some compare like before and after. So before AI, the patient often need to call the clinic. The reception staff, our MOA, spend a large portion of their day answering phone calls. And we are involving AI phone answering system as well. So the doctors and doctors document everything manually. And the patient education material needed to be created manually, repeat many times. But after we implementing AI, many of these repetitive tasks become automated. Appointments can be booked online. Reminder messages sent automatically. Clinical notes generated during the consultation. Patient summaries can produced within seconds. As a result, administrative workflow decreases and the physician gain something extremely valuable, which is time. And time is probably most precious resource in healthcare. Here is about the clinical impact. Ultimately, technology should be evaluated by its clinical impact, not how impressive it looks. So in our experience, AI has reduced the documentation time, improved the workflow, and strengthened the physician-patient interaction. Now I can face to the patient to review all the details and help reducing the physician burnout. So about the AI and longevity care, this brings us to this topic that I'm personally most passionate about, longevity medicine. The goal of AI is not simply to make physician work faster. The goal is to allow physicians to practice better medicine. When administrative work is reduced, we have more opportunity to discuss about like a preventive care. We can spend more time managing chronic disease, reviewing lifestyle factors, encouraging exercise, improving nutrition, and identify health risk before disease develops. So in other words, AI helps shift healthcare from reactive medicine towards proactive medicine. And I believe that the transition is essential if we truly want to help people to live longer and healthier lives. For the future, as we look ahead, I believe this is only the beginning. So AI is evolving incredibly fast, and healthcare is just starting to realize its potential. In the future, we will likely see deeper integration between AI and electronic medical records. AI will become even better at identifying care gaps, supporting preventive medicine, assisting clinical decision making, and helping physicians deliver more personal care. So this is why I'm always excited to collaborate in new ideas, pilot projects, clinical research, and innovative solutions that improve patient care. If today's presentation inspire even one new collaboration, then I believe it has already been worthwhile. Thank you so much for listening. Finally, I would like to leave you with the simple thought: AI will never replace compassionate physicians. And thank you very much for your attention today. I truly appreciate your time. If you have any questions or if you would like to discuss collaborations and exchange ideas, I would be delighted to continue the conversation. Thank you so much.
Thank you kindly.